Hello, everyone. Welcome to Spine Talks. I'm Dr. Rita Roy, CEO of the National Spine Health Foundation, and we are delighted to bring you unparalleled access to world class experts like the professionals who are joining me on the panel today. Today, we're going to be talking about vertebral compression fractures and prevention of fractures. And I'm going to start by introducing my panelists, Dr. Paul Anderson from the University of Wisconsin and Dr. Lora Giangregorio from Fragility Fracture Network and the University of Waterloo in Ontario, Canada. So I'm going to start out today by asking Dr. Anderson to give us a background on what is a vertebral compression fracture.
So this is a very common injury. In fact, it's the most common fragility type fracture that we see in older adults. And it basically, the bone fails, and instead of being shaped like a rectangle, it becomes much more wedge shaped. Patient loses height and also tends to bend forward slightly. And these fractures can cause considerable pain and unfortunately also significant disability, especially when they're acute. With treatment, we do see recovery from pain and improvement of function, but unfortunately, many patients still have loss of function after this fracture.
That was a lot of information from Dr. Anderson about a fragility fracture in the vertebral body. That's a vertebral compression fracture. Fragility Fracture Network is an organization that focuses on these kinds of fractures. What does it mean to have a fragility fracture?
Fragility fractures can cause pain. They can also increase the risk of disability, and they can also increase the risk of premature mortality. So we want to try to prevent fractures to prevent that from happening.
hmm So, we're talking about fractures in your back. These are the bones of your back, your vertebral column, and a couple of big concepts that come out as we begin to think about why these fractures matter, as Dr. Anderson mentioned. It's a very common occurrence for fractures to happen, bones to break in your back. When you break bones in your back, it can lead to, as Dr. John Gregorio said, an increased rate of mortality and or loss of independence. Um, Dr. Anderson, you've seen a lot of these cases. And one of the things that people worry the most about is the limitations that they'll have in their life when they have a vertebral fracture. Can you share with us some of that clinical experience?
Yeah, so some of the consequences of vertebral fractures are both psychological and physical. Some of the psychological problems that we see is patients begin to lose confidence in their body. They tend to start restricting their activities, which is not really what we want in the end. We would like patients to resume their lifestyle to the best possibility for them. So the psychological aspects is oftentimes overcoming this fear. There's a concept called fear avoidance where people really don't do things because they're afraid they're going to fracture again. In terms of performance or function, it's not uncommon for patients not being able to take care of themselves as well. In other words, do chores around the house, or those patients who are still remain active athletically. We find that they aren't quite as good at being able to play tennis nowadays, pickleball, or gardening and other tasks that they're used to doing becomes much more difficult for them. We do have ways to mitigate that, and that's actually one of the major goals of the treatment, which we'll talk about, is how to try to maintain your independence in the future.
hmm One of the things that's important to talk about today is how you get one of these fractures. Where do they come from? How do people fracture their backs? How do you get a vertebral compression fracture? Dr. Sean Gregorio, can you talk to us about who gets these fractures and how they happen?
Yeah, so a fracture occurs when the load that's applied to bone is greater than the bone strength. So there's two kind of things that influence whether you're going to fracture: your bone strength, so how strong your bones are, and then the loads that are applied to your bones. So if, as we get older, we lose bone, and so that can increase the risk. So if you have osteoporosis or low bone mineral density, or low bone strength, you can that your fracture risk increase. There's many other risk factors that can also increase your risk of bone loss or affect your bone strength. And then on the other side of the equation, the applied load. These are the forces that are applied to bones. So the most common cause of fractures generally, whether it be hip fractures or wrist fractures, but even spine fractures, is falls. So people who fall, say for example, if they fall backwards on their bum, that applies loads that can come up through the spine and cause a fracture. But people can also fracture their spine if they're lifting heavy furniture, like, for example, lifting a mattress while trying to put sheets on the bed, or bending over to tie shoes. If your bones are really fragile, you can actually cause a fracture. So it's the forces on the bones that increase the strength of the bones. So the weaker your bones are, the less force it takes to actually break them.
So that makes sense that people want to think about maintaining their optimal bone strength so that some of these activities, like changing a mattress or low low energy activities that shouldn't cause a fracture in a normal person's body, can be avoided. And there are things that people can do to maintain their bone strength over time. You mentioned, Dr. Giangregorio, that people lose bone over time. They lose bone strength as we age. We only have up until about age 30 to build our maximum amount of bone. And from that time on, it begins to decrease. So we think about bone mineral density. We think about conditions like osteopenia and osteoporosis that can lead to a situation where your bones are weaker and you're more likely to fracture. Dr. Anderson, you mentioned the word treatment for these fractures. Let's talk a little bit about treatment for vertebral compression fractures.
Yeah. First of all, just like to emphasize to people that only one third of the vertebral fractures actually are clinical. That means that they're associated with pain that's persistent, or with some type of functional loss. And it's not uncommon for physicians to image a patient either through bone density tests or just other imagings that might be for other reasons, and find that there was a previous fracture, and they may ask you about a previous fracture, and you don't know anything about it. May have had pain for a short period of time, but you don't even remember anymore.
You might go in to get a chest x ray if you think you have bronchitis or pneumonia, and there's a bone fracture in there. Does that
So
happen?
this is a common scenario. In answer to your question about what are our treatments, as a spine surgeon, it's rare that we would ever want to operate on this kind of fracture. Mostly patients are going to heal well and do not need any type of spine surgeries. The one exception would be someone who's developing nerve compression, because you remember inside the spine is your spinal cord, and in the lower part of your back are your nerveries that are going down your leg. And so sometimes people get compression because the bone is pushing on those nerves, and that might require surgery, but that's usually the only indication. And 99% of patients are going to be treated with non-operative means. There is a newer technique that's been around now for 2 decades called vertebroplasty, where we put cement in the vertebrae to stiffen it up. And that's incredibly good for relieving patients who are having very severe pain and can't mobilize out of bed because their back pain is so bad. Or for someone who doesn't get better over time, we would consider though that. Again, the concept here is it's rare that you're going to need surgery for an osteoporotic fracture. But these other techniques, such as vertebroplasty, is another technique called kyphoplasty, done very similar, are both indicated for the severe pain or when someone doesn't get to better. But the majority of patients are going to be treated with non-operative means.
Anderson, thank you for taking us through those surgical treatment options for patients with vertebral fractures. But you've also mentioned that a lot of these patients don't need to have surgery. Others have worked on guidelines for how to handle these kinds of fractures. Could you speak to some of that work that's been done, Dr. John Gregorio?
Yes, it worked with the Fragility Fracture Network to come up with guidance on the management of spine fractures. And we kind of think of it under sort of three pillars. So, one being managing pain, the other being improving physical function, and then the third being preventing future falls and fractures so we don't have more fractures or more fall related injuries. And so, in pain management, there are options, there are medications that people can take for pain, and that would be decided on with their physician. Some people can get by with certain medications. Some people need other types of medication. We also recommend that people avoid prolonged bed rest and avoid using braces because that can actually promote immobility, which over time may not be helpful. And then we also encourage people to, um, work with other health professionals to develop strategies to improve their physical functioning. And that might be, for example, using an assistive device or getting an occupational therapist to, give them advice on how to do movement safely or get groceries, or they might need to get help with groceries for a little while they're recovering. But the important thing about pain management is also understanding that, yes, you may have pain for a while after a vertebral fracture, but it should get better over time. And if it doesn't, then you want to go back to your doctor to have a conversation about how to better manage that pain. But understanding that it will probably get better over, because we don't want to create fear and we don't want to create anxiety about that pain. And then thinking back again to physical functioning, also trying strategies of eventually having a plan to do an exercise program to improve physical functioning. So, to improve your balance, to improve your muscular strength, to work on the muscles that support your spine, and potentially improve your posture. So that would be important, and you can work with a physical therapist or an exercise physiologist to design an exercise program or find resources to support you in developing an exercise program. And then the last pillar being sort of preventing falls and fractures. And there's many strategies we can do with that. We want to ensure that people have adequate nutrition, and that means adequate calcium, adequate vitamin D, as well as adequate calories. We want to avoid weight loss because losing weight means you're losing muscle and bone, and that can increase the risk of fractures. So getting adequate calories, calcium, vitamin D, as well as other nutrients, and then medication for bone strength, and then other strategies for preventing falls. So I mentioned already assistive device use, but maybe even a home hazard assessment to reduce the risk of falls in your environment. And then finally, an exercise program to prevent falls, to get your muscles stronger and how we prevent future fractures.
And when you talk about assistive devices, you're talking about things like a cane or a walker, or things that can help you, tools that can help you with your balance to prevent a fall.
But it can also mean things like, for example, if I want to avoid bending over to get laundry out of a laundry machine, I could get a grabber tool, right? And that can help me so that I'm not flexing my spine and creating pain. Or a grabber tool to help reach things overhead, for example. Or having, you know, a stool in a bathtub so that I can sit if I'm finding my back is getting fatigued, or having a grabber bar that I can hold on to get my balance when I'm getting in and out of the tub or getting out of the shower. So assistive devices are basically anything that can compensate for an impairment or fear or concern that you have.
Right.
Yeah.
And so because a lot of these fractures can heal on their own, what time frame does that encompass where a person should decide whether or not they're not getting better? Is it 2 weeks? Is it 3 months? What time period? And I know that's different for each person, but generally what would be that time frame that people should think about?
So a fracture will often, in theory, should heal in around 12 weeks. But if a person is experiencing severe pain or severe functional impairment, they should really talk to their doctor because there may be other options that they can consider. So we kind of encourage people to sort of return to physical activity as tolerated, but maybe avoid really heavy exertion or really heavy lifting for 12 weeks because that's probably around the time that it's going to take for a fracture to heal. But again, if they are experiencing severe pain or severe problems with doing their everyday activities because of weakness or fatigue or pain, then they should really consult their doctor about other options.
When a patient finds out that they have a fracture in their back, a compression fracture in their vertebrae, there's typically a reason why that happens, and it may be a sign that there is a problem with their bone density or a problem with their bones. And when this happens, it's important to talk about why it occurred. And as Dr. Anderson has discussed about surgical treatments, Dr. Jean Gregorio has talked to us about non surgical ways that those fractures are handled. We want to think about what is the likelihood that another fracture will occur. Dr. Anderson, can you speak to us about what the likelihood is of you getting another fracture in your back if you've already had one?
Yeah. So we've talked about treatment, and we really talked about treating the fracture and how to rehabilitate after that. The next thing comes up is, should we treat the underlying disease process? And if a patient has a fragility type vertebral fracture, you by definition have a condition we call osteoporosis. And osteoporosis is just a thinning of the bone, making it more brittle and resulting in greater likelihood of sustaining fractures. And unfortunately, once you sustained a fracture of the spine, or it could be other bones, your risk for another one goes way up. And specific to the spine, about 15% of those patients are going to sustain a new fracture somewhere in the body 15% of the time. So the chance of getting another fracture within the first year after a spine fracture is at least 15%. So one of the goals of treatment is secondary fracture prevention. And what we mean by that is, now let's treat the underlying disease. And this can occur concomitantly with rehabbing from the original fracture. We can start the diagnosing of it, making sure we understand what the cause is, and then defining a treatment program. And once you have a spine fracture, most of the time it's going to be indicated to have some type of pharmaceutical treatment of your osteoporosis. That means medication for the osteoporosis. And I would say the medication is quite effective if used and timed appropriately. Another risk is that the timing of the next fracture occurs much closer to the original one. So we need to get the medical treatment, if we're going to do it, on board fairly acutely. We're not talking the next day or anything, but hopefully within 4 to 6 weeks, that kind of therapy would start.
Dr. Anderson, thank you so much for helping us understand when it is appropriate and why it is appropriate to start medication for treating the underlying bone disease that can result in fractures. Dr. John Gregorio, can you tell us some other techniques that patients are often advised to undergo to help prevent more fractures?
Yeah, so I think one thing that's really important is to screen for malnutrition and and whether or not they're getting adequate calcium and D, and if available, a referral to a dietitian if that might be an issue. So if someone is experiencing malnutrition, they should get some guidance on eating properly, eating enough calories, eating enough calcium, vitamin D, protein. So that would be an example. The other thing would be a clinician or physician understanding kind of what resources are available in terms of occupational therapy, physical therapy, or community program. Patients can also become aware of what's available in their community so that they can find exercise programs that meet their needs, or reach out to a exercise physiologist or physical therapist for an exercise program. And there may be also resources that can help get them education on how to recover after a spine fracture. So we do advise that people avoid bed rest or lying in bed, and we avoid people use braces. So we want to encourage people to be as physically active as they can, or as their pain will tolerate, and maybe get advice from their healthcare provider, from an occupational therapist or physical therapist or their physician about the types of movements they might want to modify or avoid. So the types of movements that are often considered risky are those that involve bending forward all the way, or twisting all the way, like to the side, or doing bending or twisting rapidly or repetitively, or bending or twisting while you're lifting heavy weight. So maybe considering modifying some of those activities or getting help with some of those activities.
So, Dr. Giangregorio, what are some of the exercises that people with vertebral fractures can think about doing?
Yeah, so many fractures occur due to falls, and that is true for vertebral fractures. And it's really important to talk to your healthcare provider if you are having a fall, because there are things that you can do. And in fact, there's really strong evidence that certain types of exercise can prevent falls, as well as doing things like a home hazard assessment where you have an occupational therapist come into your home and reduce risky things. So it's really important to communicate if you are having falls or you are concerned about falling so that you can come up with a plan for preventing falls. So the types of exercise that are effective for preventing falls are exercise programs that include balance training and functional strengthening exercises and even Tai Chi. So you can find a community program that offers Tai Chi or offers exercises that challenge your balance and challenge your strength if you prefer to go out into the community and do exercise, or you can talk to your healthcare provider about having someone give you an exercise program that you can do at your home that will challenge your balance or challenge your strength. Or you can even find YouTube videos that teach Tai Chi and follow those as well. So it's trying to do exercises that challenge your balance. So like for example, you're in a position where you feel a little unstable, but you're able to maintain that position. So you don't want to do an exercise that's so difficult that's going to cause you to fall, but it should feel challenging to try to maintain your balance. And similarly, when we're trying to challenge our strength, we want to do exercises that feel like work. They feel like they're high effort so that we're challenging our muscles to get stronger. And so those are the types of exercises usually that we recommend when we want to try to prevent falls and potentially try to prevent further bone loss and further muscle loss and fractures.
Yeah, that's fantastic. And I think one of the things about the community programs that's nice is it can be motivating because so much of what you've said is that you need to do these exercises. They're exercises you can do, but they don't work if you don't do them, right? And many of them are simple things that don't require a gym or fancy equipment. There are simple things you can do right at home, and there are resources that are available to people to do them.
Yeah, so I think a lot of it is figuring out what's available to you in your community or what's available to you online that you have access to. Osteoporosis Canada develops lots of education materials under our 2 Foot to Fracture web cage where we talk about the different types of exercise that people can do. But I think it's really figuring out what is um, something that's sort of tailored to your ability. So everybody needs to kind of start where they're at. So some people might start with an easier exercise and some people might start with a harder exercise, but there's always a version that you can do to start with and then progress over time.
And people should talk to their doctor about what the right exercise is for them.
Or get a referral to an exercise physiologist or a physical therapist, or at least start with something that they feel comfortable with.
Right. I want to ask Dr. Anderson this question about what you've seen in your clinic with patients who are experiencing falls and how they talk about that with you when they come to see you.
Yeah. So I would say it's very important if you have had a fall within the last 6 months, you should tell your physician about that because there are many underlying treatable, modifiable processes that could be going on that can help prevent another fall where you may sustain a fracture. So the first thing is to disclose to the doctor who may not ask you about how often you have had a fall. That's very important. It's a difficult discussion with patients. They tend to want to hide that they're falling. They're afraid to let see or embarrassed that they're falling, but don't be. You need to let the physician know this is going to help empower you in taking control of your life and trying to maintain your independence. For instance, there's a lot of drug interaction between different medicines, such as blood pressure medicines, that can cause temporary low blood pressure. You pass out. People have poorly controlled diabetes. You can get low blood sugar, and that can cause you to faint. So there are a lot of causes that we can deal with, but you have to let the physician know. And then, assuming there aren't any other treatable causes based on your medicals, then you would be referred to a therapy to go through this fall prevention exercise program to try to prevent it. one thing you have to realize is that your bones and your muscles are very linked together, and that if you have osteoporosis, you generally also have weakened muscles. Both their muscles are atrophied. In other words, there's not as much muscle mass as there used to be. But even worse, there's oftentimes fatty substitution of the red muscle with fat, and that also considerably weakens it. And some of that is reversible with exercise. It's a little more difficult than actually treating the ball, which is actually a little bit easier. But you have to start the conversation with a physician about falls, how often you've had them, and whether they were harmful or not. These are big predictors of future falls and future fractures.
I'd like to talk a little bit about why having fractures impacts your life, your ability to live independently, and your ability to live longer. It's been an amazing conversation with these world class experts who are talking to us about fractures in your back, fractures in your vertebrae, and why they matter and what to do about them. Dr. Anderson, what are your final comments and words of wisdom for our audience today?
So you can recover from this fracture. Our aim, our goal would be to restore a functional lifestyle for you, what you want to do. Secondly, I want to reassure you that uh, we do have treatments that are effective in preventing additional fractures. And that is very important to you, not only for pain and your morbidity from the fracture or functional loss, but also even mortality. So it's really important for you to be engaged with your providers that you're going to get some type of secondary fracture prevention.
Thank you. Dr. Giangregorio, final comments.
Yeah, I think it's important to recognize that having a fracture is a sign that you're at risk for future fractures. So, in the short term, you want to have a strategy to support your recovery, reduce pain, prevent any additional weight loss or bone loss. And then in the long term, you want to have a strategy to prevent future falls and fractures. And also prevent disability. So, that might mean doing things like building muscle strength, improving your balance, doing some exercise, maybe thinking about changing your nutrition to support, healthy aging, as well as considering medications for fracture risk.
Yeah. And I would add that the medications are very effective, but they actually work a lot better if you are also exercising your musculoskeleton, because these drugs do act to a greater degree, give you more bone density improvement when you're exercising. So just being sedentary is not the best strategy. We really want people to get out and move and be as active as they can be.
Well, I want to thank Dr. John Gregorio and Dr. Anderson for joining us today to bring this really important information to our audience. At the National Spine Health Foundation, one of the things we believe in most is providing hope for recovery and helping people find the tools to advocate for themselves, to be able to get back to their lives and live life on their own terms. And the way that we do that is by partnering with experts like the professionals who are joining me today to give you this insight to help you live your best life. Thank you so much for your time. Thank you, Dr. John Gregorio. Thank you, Dr. Anderson.